CBD relieves anxiety and depression. It reduces oxidative stress and inflammation, alleviates pain, and has been shown to provide anti-cancer benefits. CBD is one of at least 120 phytocannabinoids found in the cannabis sativa plant, constituting around 40% of the plant's active compounds. Cannabidiol can be extracted from the cannabis, industrial hemp, or synthesized in a lab. Both hemp and marijuana are versions of the cannabis sativa plant. The percentage of CBD in hemp plants by dry weight is lower than the percentage of CBD in some hybrids of medical marijuana plants, but once the oil is extracted, the molecular structure of CBD is the same regardless of the source. CBD doesn't have the same psychomimetic or mind-altering effects as the main plant component THC. In fact, CBD is able to counter the mind-altering effects that's caused by the THC. CBD extracts primarily come from cannabis flowers and leaves of the cannabis plant, and from the flowers, leaves, and stalks of hemp. Hemp oil comes from the seeds of the hemp plant, but it doesn't offer the same therapeutic benefits as CBD oil. CBD oil and hemp are not the same, and they should never be confused. You won't experience the same nootropic benefits with hemp oil as you would with CBD. Depending on the hybrid, cannabis provides 5 to 35% THC, while hemp is regulated to contain less than 0.3% THC. In 1999, the US Department of Health and Human Services obtained a patent for the neuroprotective effects of cannabinoids to protect the brain from neurodegenerative diseases like Parkinson's, Alzheimer's, and other forms of dementia. CBD is anti-inflammatory, analgesic, anti-anxiety, and it provides anti-tumor properties, among others. CBD has been shown to have potential in the treatment of depression, neuroinflammation, epilepsy, oxidative stress, vomiting and nausea, anxiety, and even schizophrenia. CBD has been shown in the lab and through practical user experience to provide anti-anxiety and antidepressant effects, reducing anxiety in those with social anxiety disorder, and as an antidepressant by enhancing serotonin and glutamate signaling via the 5-HT1A receptor. CBD has gained widespread attention for treating seizure disorders like epilepsy. CBD lowers excitation in brain cells that contribute to seizures. CBD also enhances GABA, which helps to prevent seizures, and its antipsychotic effects are related to its effects on increasing the levels of anandamide. CBD acts on the CBD2 receptor to produce anti-inflammatory responses in brain immune cells. Oxidation contributes to the damage seen in diseases like Alzheimer's and Parkinson's, and inflammation has been associated with depression. CBD helps to reduce this oxidative damage and inflammation. CBD was first isolated in pure form in 1940, simultaneously from American hemp and from Egyptian hashish. Since then, much more research has been conducted on THC when compared to CBD, likely because THC produces psychomimetic effects, which is, it gets you high, and CBD does not alter your mind. Clinical studies and reports by ordinary neurohackers show that CBD can help to prevent the psychotic-like effects induced by a high dose of THC. People were using cannabis to get stoned thousands of years ago, but it's only in the last few years that scientists have begun to piece together how and what cannabis does inside the brain. Endocannabinoid is short for endogenous cannabinoid. Endogenous means it's native to our bodies. The endocannabinoid system is a group of receptors located throughout your body and your brain. It consists of signaling molecules and their receptors. The endocannabinoid system is involved in various processes, including appetite, mood, memory, pain sensation, stress response, energy balance, and metabolism, and even female reproduction. The two primary endocannabinoid receptors are CB1 and CB2. CB1 receptors are found primarily in the brain and the central nervous system. It's the main molecular target of the endocannabinoid anandamide, which is produced in your body and in the THC you get from cannabis. The other main endocannabinoid is 2-AG, or 2-arachidonyl glycerol, and this is produced in your body and from CBD when you get it from cannabis. Both 2-AG and CBD are active at both the CB1 and the CB2 receptors, but CBD cannot bind directly with the CB1 receptor like THC can. CB2 receptors are mainly expressed in immune cells in your body. The overall function of the endocannabinoid system is to maintain balance in the nervous system. Neurotransmitters that work in reverse. Normally, we think of neurotransmitters as moving in the direction of the synaptic firing. In other words, it's moving from the sending neuron to the receiving neuron to produce an action. Endocannabinoids, on the other hand, are unique because they act more like retrograde neurotransmitters. They act in the opposite direction of synaptic flow. Endocannabinoids in the synapse temporarily reduce the amount of neurotransmitter released from the sending neuron, meaning the receiving neuron exerts control over the amount of neurotransmitter that it receives. Let's circle back to cannabis. CBD and THC are collectively known as cannabinoids, and both interact with CB1 and CB2 receptors in your body and your brain. THC can dock directly to the CB1 receptor, but not CBD. Instead, CBD increases the activity of native endocannabinoid system by increasing cannabinoid receptor density and by inhibiting fatty acid amide hydrolase, which increases levels of endocannabinoids like the bliss molecule anandamide. CBD is also an agonist of the 5-HT1A receptor. So, the combination of increasing anandamide and serotonin activity likely provides the anti-anxiety and antidepressant effect that CBD has. CBD boosts brain health and function in several ways, but two in particular stand out. CBD is anti-anxiety. Human and animal studies show that CBD works as an anxiolytic. The first human study was published in 1982 on the interconnection between CBD and THC. The study worked with 8 healthy volunteers with a mean age of 27 years. The participants hadn't used cannabis in the previous 15 days. In the double-blind procedure, the volunteers received CBD, THC, THC plus CBD, diazepam, or a placebo in different sequences and days. The results showed that the increased anxiety following the administration of THC was significantly reduced with the simultaneous administration of CBD. Several other studies with humans have since been conducted to determine how CBD produces this anti-anxiety effect. The consensus appears to be that CBD alters blood flow in a specific area of the brain. One study had healthy volunteers using 400 milligrams of CBD or a placebo in a double-blind trial. The research concluded that CBD significantly reduced anxiety. The study found that CBD increased brain activity in the left para-hippocampal gyrus, and it decreased activity in the left amygdala hippocampus complex, including the fusiform gyrus. This pattern is normally associated with an anxiolytic action. Reviews of many who regularly use CBD oil report it has antidepressant effects. Studies have shown that CBD inhibits the 5-HT1A serotonin receptor activity. This would raise the levels of serotonin and provide an improvement in mood. But there's also speculation among the scientific community that CBD also provides its antidepressant effects by increasing levels of endocannabinoids like anandamide, likely by inhibiting their breakdown. CBD is an antidepressant. Other studies have shown that CBD facilitates other actions in the brain in both humans and animals, and this could contribute to the improvements in mood, including modifying the function of several receptors like the CB1, CB2, GPR55, TRPV1, and the 5-HT1A neuroreceptors. CBD also inhibits the FAAH, and this increases levels of the bliss molecule anandamide, and it inhibits the adenosine transport, which would increase levels of adenosine, all possibly contributing to a better mood and a decrease in depression. The primary culprit behind brain and neuron damage is oxidation and inflammation, and this damage can happen at any age. It's influenced by our environment, toxins, food, stress, and more. Serotonin and anandamide levels decline. Anxiety increases. Mood declines. Brain cell plasticity declines. Cognition, learning, memory, and recall decline. Free radicals damage brain cell mitochondria. CBD reduces oxidative damage by working as an antioxidant. It stimulates the production of brain-derived nootropic factor, which helps to repair damaged neurons and to assist in neurogenesis. CBD also helps repair damage to a leaky blood-brain barrier, and it prevents the inflammation that damages it in the first place. The last 5 years have shown a remarkable increase in publications on CBD, mainly stimulated by the discovery of its anti-inflammatory, antioxidant, and neuroprotective effects. These studies have highlighted a wide range of possible therapeutic effects of the CBD, with conditions like Alzheimer's and Parkinson's disease, diabetes, epilepsy, stroke, rheumatoid arthritis, and other inflammatory diseases, and nausea and cancer. Much of the evidence we have with CBD and its benefits to the brain comes from everyday users. Some is backed up by hard science and clinical trials, but it's still early days in CBD research. CBD and its effects on the body's endocannabinoid system provide positive effects on just about everything, including appetite, anxiety and depression, bone development, immune function, memory, pain perception, reproduction, and sleep. Most people report when using CBD for the first time that years of pent-up stress and anxiety begin to fade out. Many find CBD effective in relieving the symptoms of depression. You could also experience an improved quality of sleep, along with an overall improvement in mood. Many report relief from pain caused by fibromyalgia, arthritis, lupus, migraines, and back surgery. Several users report remissions from various types of cancer. Several animal studies back up this anti-cancer benefit. CBD seems to be effective in relieving the symptoms of bipolar manic depression. Others report the absence of seizures from epilepsy since starting to use CBD oil. Overall, CBD offers a calming effect for most who've tried it or use it consistently, and many talk about their first good night's sleep in years. THC produces stimulating psychoactive effects, and CBD works opposite by quelling mind-altering reactions. THC can cause paranoia, and CBD does not. A double-blind, placebo-controlled trial conducted in Brazil worked with 10 patients diagnosed with social anxiety disorder. One group received 400 milligrams of CBD, while the control group took a placebo. The researchers concluded that CBD was effective in reducing their anxiety. Another study in Brazil investigated the effects of CBD on the paranoia that's often associated with public speaking. In this trial, 24 patients diagnosed with social anxiety disorder participated. Half of the patients received 600 milligrams of CBD, and the other group received a placebo. 1.5 hours after using the CBD or the placebo, patients participated in a simulated public speaking test. The researchers found that pre-treatment with CBD significantly reduced anxiety, cognitive impairment, and discomfort in their speech performance. The placebo group presented higher anxiety, cognitive impairment, and discomfort. Over the past 10 years, research has shown that depression may be caused by elevated inflammatory cytokines in the brain. This elevation in inflammation alters the neurotransmitter systems, which can lead to psychiatric disorders and depression. Scientists are still trying to figure out exactly how CBD and other cannabinoids alleviate inflammation. Studies have shown that cannabinoid receptors play a crucial role in the regulation of the immune system, and some cannabinoids have been shown to suppress inflammatory cytokines. CBD has been shown many times in animal studies to alleviate depression using various models. CBD activates the 5-HT1A serotonin receptor. This could be behind CBD's antidepressant effects. In one study in Brazil, male Swiss mice were given CBD, a prescription drug, or a placebo. The mice were then put into the forced swim test. The study found that CBD induces antidepressant effects that were comparable to those of the prescription drug. These effects of CBD were probably mediated by activation of the 5-HT1A receptor. Several clinical trials have concluded that CBD is effective in reducing epileptic seizures in children with Dravet syndrome. The authors of the study note that the majority of these children have a mutation in a receptor channel that's expressed in inhibitory neurons associated with the GABA system in the brain. And it turns out that direct modulation of GABA sensors with CBD likely contributes to the therapeutic effect in those with severe epilepsy. Researchers at the University of Sydney investigated the effects of CBD on human GABA-A receptors. The team inserted electrodes into egg cells that were implanted with human GABA-A receptors to measure changes in electrical current following GABA administration and exposure to either CBD or 2-AG. The results showed that both CBD and 2-AG are able to modulate electrical currents via changes in the GABA-A receptor activity. Both were able to exert their effects on receptors that didn't respond to benzodiazepine. The study also found that CBD had a higher binding selectivity than that of 2-AG, meaning CBD worked more like GABA drugs that are able to reduce the symptoms of anxiety without inducing sedation. Recommended CBD doses start from 4 to 45 milligrams per day. If you've done any research or have any practical experience with CBD, that recommended dose is not very helpful. It's merely a good starting point to see how your body reacts. Doses of CBD depend on the condition that you're treating, your body weight, and how your body reacts to CBD. Doses differ from person to person. The Mayo Clinic offers the following recommendation based on scientific research. For epilepsy, 200 to 300 milligrams of CBD per day. For Huntington's disease, 10 milligrams of CBD per kg of body weight. For sleep disorders, 40 to 160 milligrams of CBD. For schizophrenia, 40 to 1,280 milligrams of CBD per day. For glaucoma, 20 to 40 milligrams of CBD. And for chronic pain, 2.5 to 20 milligrams of CBD per day. Many in the cannabis world maintain that a combination of CBD and THC in various ratios will provide greater therapeutic value than just using CBD or THC alone. The science is clear, however. CBD oil provides amazing therapeutic benefits and can be used on its own. Most neurohackers can use CBD without experiencing any unpleasant side effects, and the few that do will get minor symptoms such as mild indigestion, diarrhea, or dry mouth. Most human clinical studies include side effects reported by study participants. For example, a study published in the Brazilian Journal of Medicinal and Biological Research noted that chronic administration of CBD for 30 days to healthy volunteers at daily doses ranging from 10 to 400 milligrams failed to induce any significant alteration in neurological, psychiatric, or clinical examination. Patients suffering from Huntington's daily dose 700 milligrams of CBD for 6 weeks, and this didn't induce any toxicity, therefore confirming results from animal studies. The available clinical data also suggests that CBD can be safely administered over a wide dose range. There's no lethal dose for CBD or THC, so while you can't do permanent damage to your brain, you'll likely find that lower doses are often better and more effective than higher doses. Unwanted side effects are usually caused by poor quality CBD oil from unreliable brands. Quality matters. Hemp absorbs toxins like mercury and lead from the earth that it is grown on. So, for best results and most cost-effective results, get pure lab isolated CBD powder. Your body doesn't make CBD on its own, so to get the benefits, you must take it as a supplement. CBD is especially helpful for those dealing with anxiety and depression. CBD increases the bliss neurotransmitter anandamide, GABA and serotonin, and it helps tame inflammation in the brain. CBD is also particularly useful for treating epilepsy. Dosing CBD varies from person to person, and it requires some trial and error. Always start low to see how your body reacts. Slowly increase the dose until you achieve the benefits that you're looking for. For a powerful anti-anxiety stack with CBD, for helping with conditions like post-traumatic stress disorder, check out my video on Pick a Million.